Welcome to the Essential Guide on the Suction Machine, covering its usage, operation, and critical maintenance tips. First, let's establish what a suction machine is and why it is so important in healthcare settings. A suction machine is a critical medical appliance designed to create a vacuum to remove substances like blood, saliva, and mucus from a person's airway. Its primary functions include clearing the airway so patients can breathe, preventing pulmonary aspiration and lung infections, and clearing the operative field during surgery. When should you use a suction machine? The main indication is a patient's inability to clear their airway effectively. If a patient cannot adequately clear their airway by coughing, or if there is suspected aspiration of secretions, suctioning is necessary. Signs that suctioning is needed include a congested sounding or frequent cough, visible secretions, or an audible gurgling noise while breathing. A standard suction setup involves several key components, each essential for proper function. The core parts include the suction pump, which creates the vacuum, the collection container for fluids, and the various tubing that connects the system. Bacterial filters protect the pump from contaminants. Catheters come in two main types, the rigid Yankauer tip for oral suctioning and the non-rigid French or whistle tip for deeper suctioning. Now let's review the proper procedure for operating the suction machine. Begin by checking that all tubing is tight and the collection jar lid is sealed. Test the machine by turning it on and kinking the extension tubing. The pressure gauge must move, indicating no leaks. Adjust the pressure control dial carefully. Use 15 to 20 inches of mercury for adults and progressively lower pressures for children and infants. When suctioning, do not keep the suction engaged for more than 5 seconds for deep suctioning or 10 seconds for the tonsil tip. Always allow the patient to recover their breath between attempts. It is crucial to stop immediately if the patient shows any signs of distress or cyanosis, which is the skin turning blue due to lack of oxygen. Proper maintenance and infection control are essential for the safe and effective use of the suction machine. Always prioritize infection control by wearing personal protective equipment, such as gloves. While clean technique may suffice at home, deep nasal tracheal suctioning requires sterile technique. Empty and wash the collection canister daily. After use, suction water through the tubing to thoroughly rinse away any remaining mucus and secretions. Never fill the collection container more than 75% full. Overfilling can allow liquid to enter and severely damage the pump mechanism. Common troubleshooting issues include clogs in the tubing, leaks, often around the jar lid or connections, and eventual motor failure.